toolify the concept of attachment portfolio management. One of the core issues in mental health is having adequate number of good attachments. And that is where most patients fail. Not only most patients, most human beings fail, including the therapists themselves. It's not easy to find good people and to have good relations with them over a relatively long period of time. So good enduring relationships are not easy to develop or sustain. And this creates attachment vacuum, which is the bane of the modern man. Loneliness has become a global pandemic. Psychological pandemics arising out of early life object deprivation. These psychological pandemics are on in the world for decades now, just that nobody wants to recognize them and deal with the problem as it is. Most of the clients who come to us for therapy, rarely a few of them have adequately populated good attachment portfolio at the time when they come for therapy. In all probability, long-standing pathology would have destroyed most of relationships and prevented new ones from coming in. Just as it is necessary in the stock market to create a portfolio and not invest only in one script, to diversify the risks and ensure safety. The same is true in the emotional world also, that we have to invest our emotions in 5 to 7 people and not in one person. If we invest only in one person and something happens to that attachment, the fountain of anxiety will start flowing out. And there's nothing else that can happen. If you are invested only in one person and that relation is endangered, it's natural that anxiety will mount. And this will be a crippling anxiety, not a productive anxiety. So it is very necessary at every stage of life to have a good attachment portfolio where in different capacities, be it as friends, mentors, lovers, cousins, in different capacities, we have strong enduring attachments in different colors and flavors in our basket of attachments. So creating a good attachment portfolio and managing it well is not only central requirement for mental health, but in most cases, this is the goal for most of our clients, how to reach there. If not the only goal, this is one of the important goals for most clients who come to us. This concept, unfortunately, has neither been coined correctly nor used as much as it should be used in therapy. The concept of attachment portfolio management, how many attachments you have in your portfolio, in your basket, what is the nature of these attachments? Are they equitable? Are they benign? Are they exciting? Are they exploitative? Are they parasitic? What is the nature of attachments you have in your portfolio? that analysis and then to create a healthy, enduring, good attachment portfolio, the type of attachment portfolio you would like to have can be the central focus of not only analysis but also as a goal, at least one of the important goals. So let us go to this subject today. Start by inquiring with the client. Let us try to understand your present attachments. Who are the people you are closely attached to? Then the person narrates out, lists out those he is attached to. Let us go into then take up the top 3 or top 5. Let us go into the nature of these attachments. How do you see them? And the person narrates out the qualitative aspect and the intensity of those attachments. Find out the lacunae. Find out the insights which come from this portfolio analysis and bring it up for discussion. And ask the person what kind of attachment portfolio would he like to have in the light of what both of you already have discussed about what type the person is, what is his real socio-economic and psychological condition. Then go to the realistic aspect of what is possible, and then what is possible, ask the person to go out into action. And as he tries to go out into action, difficulties will come in. The most important will be the fear of closeness or the fear of attack or the fear of abandonment. And as they come up in practice, you start working on them in the sessions, slowly allowing the person to go closer to the realization of a realistic and optimized attachment portfolio and empowering him with knowledge and guidance in practice through which strength is built for good attachment management in future. So it's a very important concept of attachment portfolio management, as important or probably more important than stock market portfolio management. Deploy this concept. Let me know how it turns. If you want to know something more, write to me about this. On the deeper side, as you go into it, the lifelong learning, the Oedipal events, the pre-Oedipal events, everything will come up as you push or rather facilitate or rather encourage a movement towards good attachment portfolio management. Thank you.